If you are sexually active or inject drugs, there are more ways than ever to prevent HIV. You can use condoms every time you have sex. You can never share needles or other drug injection equipment. You can take medicine called PrEP. When taken as prescribed, PrEP is highly effective in preventing HIV from sex and injection drug use. You can get tested and treated for other STDs, since having another STD can increase the chance of you getting HIV. You can also choose other sexual activities with little to no risk for getting HIV, such as oral sex. But remember, oral sex can transmit other STDs like chlamydia, gonorrhea, or syphilis. If you inject drugs, you can lower your risk by using clean needles or cleaning your used needles and drug injection equipment with bleach and clean water.
We get this question all the time. People ask, why do we educate folks on how to use needles correctly for drug usage? It's because of the fact that us saying that, hey, don't use drugs, we know that that's not going to happen for the minority of people who actually do drugs. So if they're going to use drugs, you have to give them education and preventative measures to make sure that they don't get infected with HIV or other things. So that's why we give this instruction to tell people, hey, make sure you use clean needles, so on and so forth. So that's the reason why. We're not promoting the usage of drugs. It just is what it is. We live in a world where, as it is and not how it should be.
If your sex partner has HIV, you should encourage them to take their HIV medicine. HIV medicine can prevent sexual transmission to others. For more information on how to prevent HIV, visit cdc.gov/HIV.
And we used to focus on the homosexual population, but now we're starting to prescribe it for people outside of it, people who are very sexually active with multiple partners. They can actually get on PrEP now. PrEP 101, you guys can get this information from the CDC. It's just explaining what PrEP is. It's just pre-exposure prophylaxis, can be pills, shots that reduce your chances of getting HIV. And then you have to determine, is PrEP right for you? You have had anal or vaginal sex in the past 6 months and have a sexual partner with HIV, especially if the partner has an unknown or detectable viral load, which means it's not suppressed as low as it can get, have not consistently used a condom, or have been diagnosed with an STD in the past 6 months. If you inject drugs, or you have been prescribed PEP, post-exposure prophylaxis, and report continued risky behavior, or have used multiple courses of PEP. Have to reiterate this, visit your healthcare provider to find out if PrEP is right for you. Routinely as recommended for follow-up visits, HIV tests, and prescription refills or shots. We talk about this all the time on this channel. And then how can you get help to pay for PrEP? Most of your insurance companies actually cover it. And then if you don't have insurance, consider enrolling in the insurance marketplace PrEP assistance program or your state's Medicaid plan if you are eligible. And this is for PrEP as well. Take one pill every day. It just goes down to PrEP basics. All of this can be found on hiv.gov. Okay. There's multiple ways using HIV medication to reduce risk. HIV treatment as prevention, pre-exposure prophylaxis, that is PrEP, post-exposure prophylaxis, that's HIV medication, reducing risk from alcohol and drug use, alcohol and HIV risk, substance use and HIV risk. This is all prevention measures. Reducing sexual risk, preventing sexual transmission of HIV. What's missing on this list, guys? Do you see anything that has to do with abstinence? It would make my job so much easier if people wasn't out there sneaking in. But we know that's not going to happen. So you have to acquiesce to what's actually going on in the world. You cannot overlook these things. So we have to give education, give preventative measures to make sure that people are protected, because people are not going to stop having sex. It just is what it is. At least just have sex with one person. But that shit ain't going to happen. Okay? People going to sneak in.